Hey, so today we're going to talk about how does Sensodyne Pronamel desensitize teeth. So basically, all of the Sensodyne Pronamel toothpastes, they use potassium nitrate as the desensitizing agent, and that is without exception. We could go through all of these Pronamel toothpastes, and you will see that they all contain potassium nitrate in there. It's typically at a 5% concentration. All right, just to kind of show you right there. So basically how potassium nitrate works is that it acts as a nerve depolarizer, which interferes with action potential generation. So for what that actually means, you actually have to remember what or how the action potential generation works. So if you remember the nerve diagram where you have like different concentrations of sodium and then also a potassium, and then there are like the channels where they kind of flow outwards down the concentration gradient. So under normal circumstances, right, outside of the nerve cell, you have an overabundance of sodium ions and a low concentration of potassium ions. But on the inside of the cell, it's the opposite. You have a high concentration of potassium ions and a low concentration of sodium ions. So typically how it works is that the gates open and then it flows from an area of high concentration towards low concentration. So the first step is that the sodium channels open and all the sodium flows into the cell, and then the potassium channels open and all the potassium flows from inside to outside. So the way the Pronamel toothpastes work is that it has a lot of potassium ions in there. So it floods the outside of the nerve cell with potassium ions, and it kind of reverses the concentration gradient. So now you have a very large concentration of potassium ions on the outside, and then that kind of prevents it from flowing outwards because there's already too much potassium ions outside. So because of that, it kind of stops the nerve cell from sending pain signals whenever you drink something cold. Okay, so that is essentially how potassium nitrate will desensitize your teeth, or generally I guess that is how Pronamel toothpastes will desensitize your teeth. So a common question you're probably curious about is how long does it take to desensitize your teeth? It actually takes quite a bit of time for the potassium nitrate to start working. So the first day that you use this toothpaste, you probably won't see an effect immediately, but over the next couple of days and up to about like 2 weeks, you'll probably see an appreciable result. But it doesn't take but it takes until about 16 weeks for you to see the full desensitizing effect from these toothpastes. The reason is that most of the time when we get sensitivity, right, it's because when the gums kind of recede, and then we have these exposed dentinal tubules, which kind of lead straight to the tooth nerve. But when you brush with the toothpaste, it takes time for it to kind of travel through these tubules and get to the nerve before it starts working. But even after it gets there, it needs to kind of build up to a sufficient concentration of the potassium ions for it to actually depolarize the tooth nerve. And then that takes about 16 weeks for you to get the full maximum effect. But overall, you can expect to see like a result after about 2 weeks or so. But that's not the max desensitizing effect. You have to use it for at least 16 weeks. One thing to kind of keep in mind is that you do have to keep using this toothpaste because the body will actually start to take back the potassium ions to kind of reestablish the original concentration gradients. So once you stop using the toothpaste, you'll notice the desensitizing effects start waning over time. All right, and then just to cover one last thing, so the way the Pronamel toothpastes work is that they use the potassium nitrate as the desensitizing agent, but there are also a ton of other toothpaste desensitizing agents, such as stannous fluoride, which Sensodyne also makes. So Sensodyne doesn't only use the potassium nitrate; they also use stannous fluoride in some of their products. Right there, stannous fluoride, anti-hypersensitivity. So if you're buying Sensodyne toothpastes, some of the Sensodyne ones will use potassium nitrate and some of them will use the stannous fluoride. But all of the Pronamel toothpastes use the potassium nitrate, so that's just one difference. So the way the stannous fluoride works in desensitizing teeth is a little different from the potassium nitrate. So how the stannous fluoride works is that it actually blocks these open tubules, right? It'll just clog them up, and then that kind of prevents the nerve from being stimulated. So basically, all the stannous fluoride was sort of clog up all these holes, and then it sort of blocks the nerve from being stimulated. So that's a little different. And then another desensitizing agent would be the hydroxyapatite, such as these fancy new trendy toothpastes here, like by David, where they say sensitive plus whitening. So there is no potassium nitrate in here, and there is no stannous fluoride, but the desensitizing agent in here is actually the hydroxyapatite. The way that works is similar to the stannous fluoride in that they block the exposed tubules, and it prevents the nerve from being stimulated, just like it's like there. But yeah, but that is basically the gist of how Pronamel sensitive toothpaste works. I mean, just a little tip: if one of these desensitizers aren't working for you, you might want to try another one. That one, depending on which one works better for you, you should stick with that one. All right, and that's it.